Thank you very much, Madam Chairwoman. Good hearing today, very interesting, learning a lot. Dr. Collins, given the fact that the symptoms of long COVID mimic the symptoms of a lot of other disease states, I guess a very basic question is how are we just ruling out these other diseases coincidentally showing up in these patients?
Another great question. The easiest way to be sure in a given individual that this is a consequence of the COVID infection is to have absolutely clear definition that they had the acute illness with the positive viral test. If that's not available, then an antibody test to show that they previously had it. Having said that, going back a year where tests were not so readily available and the antibodies may have waned by now, we have a lot of people, and you'll hear in the second panel what this has been like for folks who have the symptoms of long COVID, but don't have this clear laboratory evidence of having had the acute infection. And we need to take care of those folks as well. But more recently now that I think we have widespread testing that's available, and we talked about RADx a bit earlier, which has contributed to that, I think we are in a circumstance to be able to have that part of the diagnosis. But I think maybe your question is also suggesting maybe there are people who had acute COVID infection and now they're having something else that isn't really related to that, but was going to happen anyway. Somebody who has the onset of a new illness like rheumatoid arthritis. And so they're having a lot of joint pains. You might assume, therefore, oh, this must be long COVID, but it might be something else. So the people who are running the clinics, and you'll hear from two of them in the next panel, have to watch closely that we don't end up merging together conditions that don't belong there, and maybe things that really aren't long COVID but deserve a different kind of treatment need to be recognized and appropriately managed.
I'm one of those diseases. I've got, unfortunately, some constituents who suffer from chronic fatigue syndrome, ME, and they're very concerned, about that, and wondered, that's an entity, as I understand it, unto itself. But one of the main symptoms that for folks with long COVID talk about is this chronic fatigue. It does. And with as I understand it, with some of the studies on chronic fatigue, they think it might be virally induced. Could it be that, some of this has been other viruses, other things have caused this? And are there studies going on right now with long COVID causing or increasing the frequency of chronic fatigue syndrome?
There is certainly a lot of overlap in the symptoms, and I think we need to learn from that. People with chronic fatigue syndrome many times report an acute illness that sounded like it was a viral infection of some sort, a fever, maybe being in bed for a day or two, but then they don't get better. And that has a lot of overlaps now with what we're seeing with long COVID. With chronic fatigue, though, we almost never actually catch the original infection in the act, so we don't know what it was. But it could be that this is a pathway that other infections can also induce occasionally in individuals. My hope would be that as we study long COVID and look at those comparisons with chronic fatigue syndrome, we'll learn a lot about both of them. We'll figure out how they are similar, how they are different, and how, if we can identify interventions, they might work for both of those groups, because there's lots and lots of people with chronic fatigue syndrome who are still waiting for something that's going to help them.
Right. Yeah, might be some overlap. I guess lastly, my team and I have been reading a little bit about the high levels of cytokine secretions that occur sometimes in relationship to the disease, and wondered if that's a biomarker for long COVID potentially, and are you looking at other biomarkers to again help us get a handle on cause and effect?
Well, you're right on the place we need to go. And certainly we see cytokine elevations, even cytokine storms in people with acute illness, particularly those that are very sick in the hospital. But hasn't been so obvious in people months later who are still suffering from long COVID. There is a very interesting paper just came out about a few days ago in the journal called Nature, where they studied 73,000 veterans and followed them 6 months after they had an acute COVID infection and looked to see were there any kind of markers there. There's nothing that jumps out at you like, oh, wow, that's it. But there are laboratory abnormalities that do seem to occur more frequently in people with long COVID than in the people who didn't end up with that consequence. So that's kind of a start. We want to take that kind of a study and expand it even more rigorously to more and more groups. But that was a really important one.
Very good, very good. Well, thank you, Dr. Collins, for all your work, and thank goodness we have NIH, and you're doing wonderful things, and look for more great things in the future. I yield back, Madam Chair.